Hello and welcome everyone to today's webinar where we're asking the questions, can pets power health in Europe? Apologies for the delayed start this afternoon. My name is Dave Keating. I'm a journalist based here in Brussels, and I'm going to be guiding us through today's conversation. This is a topic that I think is a really fun one. It's certainly a lot more fun than a lot of the topics that I deal with as a journalist in Brussels. I'm really looking forward to seeing all of your pets and hearing some of the anecdotes and stories about how important pets can be to people's lives. But we also know that this is a serious topic as well. We are now coming out of this unprecedented lockdown situation that was very difficult for a lot of people. And we know that we hear anecdotally that pets were really essential in getting people through these difficult times, particularly older people. And so the topic we're talking about today is not just how nice it is to have pets around, but also how they can be a crucial part of developing strategies for people's mental well-being and also their physical health. Now, we are going to be talking about different strategies, both at EU and national level, to help develop this. We know that both the EU and national governments are now formulating their strategies for an economic recovery from the coronavirus pandemic. But what about a mental health recovery? It's one of the topics we'll be talking about today. Now, you guys will be able to participate in this conversation. You can put your questions forward to the panelists on the Glisser platform. You just want to click on the plus button on the bottom right, and then you can put in your questions. Also, we want you to participate on Twitter. The hashtag to use is PetPower. When you put that hashtag on your tweets on Twitter, they're going to appear right there on the Glisser platform. So what we want you guys to do is actually take pictures with your pets who you're there with watching at home and share them with that hashtag, and then we can all see your amazing pets. I unfortunately have no pet to share with you because it's a sad fact. I have never had a pet, actually. My family had a dog when I was growing up, but as an adult, I've never had my own pet. But perhaps motivated by the lockdown, I am finally thinking about getting one. I'm thinking about getting a cat. So let's see if you guys can convince me by the end of this panel how great it is to have a pet and that I should definitely run out and get one. So let's start out with a poll question for you guys. You're going to see that poll question pop up on your screen now. The question is, the European Commissioner for Agriculture, Janusz Wojciechowski, is well known to be an animal lover, but just how many cats do you think share his home? So this is the agriculture commissioner in the commission. It's from Poland, and he has a lot of cats, but how many does he have? Your options are 3, 7, 15, or 23. I'll give you guys a second to go ahead and answer. Okay, I think that's enough time. So if we can go ahead and tally that vote, let's see what we've ended up with. Okay, so we have okay, so 7, I'm not sure I understand the data here, hold on. So we've got 7, 15, 0, 17, and 15 at 23%. Let's see if that the numbers can pop up there. Some things at 23%, but I'm not sure. Let's go ahead to our first speaker, and then I'm going to, here we go. Okay, so it looks like the winner is 3 at 23%. And we will tell you who got the correct answer, how many cats he has, after we go to our first speaker. So our first speaker is going to be our host, which is the center-right Finnish MEP Sirpa Pitkäinen. Sirpa, I hand it over to you to give us the opening remarks today.
Welcome all of the pets and pet lovers and other human beings here online on thinking and discussing about what is the role of pets for our well-being. And if you tried guessing what is the commissioner's amount of cats, you might guess how many cats I have at the moment. You can put the results on chat or somewhere, or just sort of take a note of yourself. I'll disclose the right answer when I'll conclude my welcoming remarks. I myself, contrary to our wonderful mediator of the panel, have had pets all of my life, so I'm the right person to convince you to have cats or dogs, that matter. There was a dog in my house when I was born, and since that I have had both dogs and cats. So there's no wonder that the home doesn't feel like a home. It is just a room or just a house without any companion animals. And the companion animals have multiple roles, and we have quite a lot of studies about that in Europe too. So it is not only my personal feeling that is guiding us to this direction. They actually lower your blood pressure. And did you know that they sell CDs in France that are the cat purring? Because if you hear cat purring, that slows your heart rate, reduces cortisol and adrenaline shots in your blood, and it lowers your blood pressure. So why not to have the cat? And of course, if you can't have it, then you can have the CD or other taping of cat purring. But we all know the feeling when the cat is here and purrs, so the dog looks at you, it feels good. And the feel good is the endorphins in our body that are doing a lot of repair and good to our psyche and our physiology. The cats and dogs can have a role, as you know. They can identify low blood sugars by smelling you, or some other diseases. They are even some trained dogs to identify some types of the cancers with their very delicate smell capabilities. So this is very concrete side of the health and well-being. But let's pick up the most obvious one, and this is the mental health. EU is working with the mental health program as it should, and the mental health was one of the most hard-hit areas of the health during this COVID-19 crisis. It has been quite a stressful time for children, youngsters, people in work life, with families, without families, and then with elderly people and people with care responsibilities in different places. And there, what has been found is that the pets and companion animals play a crucial role. They are sort of the mediators in the family when the tensions run high. You can always say, look at that funny dog, or what the cat just did, and laugh a bit. They are the companions for be it spouses or be it children that feel left alone, or with bad feelings in family intense situations. That is the someone to whom you can share your worries and your tears and hug, and with whom you get the unconditional love. That is even more important to those people living alone, and especially elderly people. It is studied that we as human beings, we need touch, someone petting us, touching us, to completely be alive, to get these endorphins running, and to get our physical and mental health okay. And quite many people, especially elderly people living alone, do not have anyone touching them. Imagine this. And there, if you could have your dog who comes and licks you, whom you can hug, or cat that swirls around your chest and purrs there. It is the whole thing. It is a living being whom you can follow, even if you wish share your thoughts. You get reactions, and at least we all animal companions know that when you are happy or your pets are happy, and then when you are upset or saddened, they know and they react on that. So that is the next best for a good spouse or a best friend. And sometimes not even the next best, it can be the best what you have had. And that's why we should have the pets, and we should actually encourage people to take good care, of course, about their pets, but to have pets in their houses. And the society should be a bit more tolerant about pets, let's say in elderly care homes and places like this. And then to conclude, and I'm very happy to be part of this Pet Power. I've shared my picture already by now about me and my cat. So I do have 3 cats at the moment. And one of them is the macho, one of them is the intellectual, and one of them is the one cat's admirer club, always looking, oh, I just admire you. It's so wonderful. And what could be any better after a hard day and a lot of fights of having one cat's fan club to meet you at the door and sofa and just tell you, you are the most wonderful thing in the planet. Thank you, and all the best for this event.
Thanks very much, Serpa. It sounds like cats with a lot of personality there. I like those descriptions. So that's a good number of cats that you have, but you are beat by the EU Agriculture Commissioner, who actually has 15 cats. Most of you guessed 3, which is like a fair guess. I think that's how many cats someone would have, but no, he has 15. So that must be quite a sight, I can only imagine. I think we had a picture there of some of those cats that you could see. Okay, so now let's turn to hear a little bit more about the Pet Alliance. We're now going to hear from Animal Health Europe President Hans-Günther Dietrich. Hans-Günther?
Thank you and good afternoon. I'm really very happy to be here today and to officially announce this new partnership between Animal Health Europe and FEDIAF, leading to the Pet Alliance Europe. Animal health care and nutrition are 2 important pillars of responsible pet care. An important topic for our discussion today and for our joint project on Pet Power. You will often hear us talking about Pet Power. This is our way of referring to the special bond between our species and the many benefits that can be drawn from relationships and interactions between people and companion animals. It is another way of talking about the human-animal bond. This is something I have great experience of personally, as through the years my family has included all sorts of pets, budgies, guinea pigs, hamsters, and rabbits. These animals have all brought great joy to my family. There's a multitude of peer-reviewed studies to illustrate the myriad beneficial efforts and effects of pet ownership to people, with positive impacts on areas such as physical well-being, mental health, companionship, early child development, healthy aging, and last but not least, social inclusion of marginalized and disadvantaged people. Our alliance has pulled together an overview of some key findings of these studies, which you can find in a booklet that will be linked to the event follow-up email or can be found on our new website. We very much look forward to hearing now from Professor Grandjean on the NOSAS COVID-19 detection docs project and from the European Commission on the role the EU can play in ensuring the care of animals involved in animal-assisted interventions and other services. Thank you.
Thanks very much, Hans Gunther. Now, let's turn next to Professor Dominique Grandjean, who will be presenting the project NOSAS COVID-19 by École Nationale Vétérinaire d'Alfort, ENVA. Professor, tell us a little bit about this project.
Thank you. Hi, everybody from Paris. The NOSAS team is a research team of Alfort National Veterinary School close to Paris that's working on medical detection dogs ahead of the arrival of COVID-19. We were working on colon cancers, high-risk prostate cancers, and we start also some programs on bladder cancers and Parkinson's disease. But what happened early March 2020 is that we had a meeting with 3 people, including myself, Riyad Sarkis, who is a surgeon, a human surgeon, professor at the University of Beirut, Lebanon, Clotilde Julien, who is my direct assistant here at the vet school, and the subject came on COVID, and well, they said maybe we should try. It's a viral disease. It's never been done, etc., etc. And we decided to try, actually, which was something a little bit crazy because we didn't have much information on the virus produced molecules in humans, and quite immediately we were followed by the Emirates, the UAE. Who was interested also in the project, and so we started. We found some dogs. Most of them were coming from fire department, and we stayed since the beginning the same philosophy, which is whatever we do, we want to share all the results and the methodology on an international scale. We don't want to make any business, and we never answered positively to any private company wanting to make business out of the sniffing dogs. And we want to push the concept of dogs serving humanity. And by doing that work, we thought also that we could break some paradigms, and that maybe in the future the dog could also be seen as a real help in such situation as the pandemic we are living since months and months. So the concept is to optimize the canine olfactory capacities to focus on the detection of SARS-CoV-2 portage in humans. And of course, the idea was to provide a new mass pre-testing system, let's say. We never wanted to have the dogs taking the place of the PCR, which is supposed to be the gold standard, supposed because it's not exactly a gold standard. And we also wanted to provide an easy and cheap testing method for poor countries. Actually, what happens in the body is that the virus, when it enters the cell to replicate, is producing some catabolites, especially catabolites of the spike proteins that can go outside of the body through saliva, urine, sweat, etc. And also some induced cellular catabolites that will produce some volatile organic compounds that the dog should be able to find. So that was the concept. We started in a fully One Health concept because the people who are working on that are human doctors, veterinarians, dog handlers, and dogs. And we started to learn new things about the olfactory capacities of dogs. Just to show you an example, a quick example of how we started. This is a dog that's being trained to find some positive samples of sweat that is taken under the arms. So when he finds a positive, when he is imprinted, he's going to mark by sitting in front of that cone. And the cone was designed so that the others are easy to find for the dogs, and so that there is no direct contact for the dog with the sample. So that's the system we've been using since the beginning. We changed now because we have some new concept arriving. And the cone is really a way to enhance the imprinting, and it's something that we had to design by ourselves and find someone to set that up. The second thing which is important with dogs is that when they work, of course, playing is the best reward. They might be rewarded with food, but most of the time the best option is playing. So it's to stay in a full welfare for the dog. And of course, we've been running some PCR regularly every single month. So all the dogs that were working were tested. And you will see that a lot of countries have been working with us or on their side since the beginning. And out of something like 800 dogs that are now working and able to find COVID, none of them never did show positive on COVID, and none of them was sick. So we've been taking some auxiliary sweat samples. We've also been working on masks. Other countries have been working on urine or saliva samples. And now we worked with the Pasteur Institute in order to have Pasteur producing for us a lure, which is actually the virus that is cultivated on cells, and then they destroy the virus and they take the proteins out so that we have some spike protein and some N protein. And in the nose of the dog, actually, you have two different types of molecules that are active. One is the group of volatile organic compounds coming from the catabolites produced by the virus. And they go on the nasal mucosa, the olfactory mucosa, where there are some receptors. And these proteins go on the Jacobson organ, the vomeronasal organ of the dog. We don't have such an organ in humans, but that's how the dogs can recognize themselves when they sniff each other or when they sniff females in heats, because it's able to fix the big molecules. So what happens is that, for example, when people are breathing, they exhale some of these proteins, and the proteins are heavy, so they fall on the floor and on the garments. Plus the fact that we have the sweat and all, and the saliva and the urine that is providing some volatile organic compounds. So the dog is able to find all that. To tell you exactly what, how many countries are working with us or aside of us in the world, you have all the flags of all these countries. So there's more than 56, I guess, actually. The World Health Organization is also working with us, and regularly we have some symposiums to combine all the informations coming from the different countries. And we are all in the different countries working on some practical application now. We've been working with firefighters since the beginning, and the ones who have been working with us are now using the dogs for their own rescue centers on a regular basis. Some people thought that, well, maybe the dogs would be in the crowd, and would detect the positive people. This is not possible, simply because the others are coming from lots of people who are staying together, and they get mixed up. And so it's not like the plume scenting you might have heard about regarding explosive search. This cannot work. So we need to focus on some practical applications, like, for example, what we do in France, actually, in collaboration with the On des Chiens nonprofit. They have dogs in nursing homes to help the people with poor mobility, or to make some mediation. So you have a lot of people, roughly 40% of the people here are Alzheimer people, and it's impossible to make a PCR test on these poor people. So we make some samples, and they have one dog per nursing home who's regularly checking everybody, including the visitors. Another option is what's done in France also. We have units that check and analyze the wastewaters in different suburbs in cities. And when they have a positive one, then we can send dogs, immediately deploy them to check the people living in these suburbs or factories and so on. In airports, that's Dubai Airport, for example. They deployed dogs in Dubai coming from different administrations. So they make sweat samples on the arriving people and they're immediately sniffed by the dogs. This is in Santiago de Chile airport with the Carabineros de Chile, same system. This is in Beirut, Lebanon. When people arrive, they get sampled, also sweat by some locals, and they put the samples in these small boxes. And then what happens is that on the other side of the wall, you have the cones, and you have one dog that is going to sniff everything. So it goes pretty quick, and this way they don't lose time with the arriving passengers. This is in the Emirates, where they control everything at the border with Saudi Arabia. In that case, there's no samples. You know, the people stay, the truckers or the people in vehicles, they stay inside because it's warm. It's too hot. So you just open the door and the dog is sniffing inside the car and says if it's positive or negative. In Russia, they check the passengers before they board the plane, which is pretty clever in my opinion, because this way the positive stay in their country. In Miami airport, they just started to have dogs sniffing the masks that the passengers are wearing during the flight. And once again, we've been working on masks, and we have exactly the same results, which means a sensitivity close to 95% and a specificity around 92, 94% on masks and on swabs. In the Emirates, also they have some mobile units. So they designed some some small trucks that they can send in the villages. They have two sets of cones inside the vehicle, and so they can make the sample around the vehicle and immediately have the dogs sniffing the samples inside the vehicle, which is of course air conditioned. What else do we have? This is in Florida, another system. The dogs are, it's Florida International University. When the students have a lecture, they have an assigned seat with a number on the seat, and the dog is coming after the lectures and he's sniffing all the seats. And if one seat shows up positive, then the student is immediately isolated. This is what the University of Hanover, my good friends, are doing right now in concerts in Germany. They check all the people coming into the concert halls with a quick sniff system, and actually they do it much quickly than the ticketing of the concert, so it works pretty good. You probably heard about the Miami Heat NBA team. They have dogs to check the spectators at the entrance. It's a direct sniffing on the person. And we also stopped doing that in France, in football, in rugby. And we did it on a sled dog race that we organized every single year to check the staff, to check the competitors, and to check also the local volunteers. And that was for us the only way to get the official authorization from the French government. So you see, that's a positive marking. So that's different kind of categories that you might find in the future. Now, what we did also was to try to get information from the public in order to see if the public was okay or not with the use of dogs for COVID testing. We did that in different parts of the world. So it's not a professional stuff, but at least it provides you an idea. When you look at the different geographical zones, you see that Russia and China, for example, they never heard, or they very poorly heard about COVID detection dogs. But if you look at the acceptance of the public regarding the fact that dogs can be detecting them for COVID, you see that except for China, it's really well accepted by a vast majority of people. Then what we looked is that we had some people refusing to be tested by dogs, so we wanted to know why. And honestly, we thought this would be for mainly for religious reasons, reasons that the few people who refused. But actually, you see that the major stuff is ethics. The poor dogs are working when nobody asks them if they want to work, etc., etc. I think we need to explain to people that working dogs, actually, for them, it's a game. They play, and they do that because they're in a perfect mental welfare. Now, the sites of deployment preferences, well, the airports are number one, but then we find universities, schools, hospitals, nursing homes, and events. If we look at are the people okay to be detected directly, which means not on samples, but directly sniffed themselves, well, we see that except for China, it's really good for America, Europe, Russia. And for those who accept, we ask them if they would also agree to be touched by the animal. And we see that very few of them actually are I mean, something like 6 or 7% refuse to be touched by the animal. So it means for us that we need to train the dogs not to touch the people when they sniff. And finally, what's interesting is the confidence that the people have in the different tests that they are facing, including the dog detection test. If you look at the other tests around the world, nobody trusts them. I think they're right. But if you look at the dogs, you see that in Europe, the dogs are more trusted than PCR. It's the same in North America. It's close to be the same in South America. So it's not only that people accept to be tested by dogs, but it's also that they trust the results that are obtained by the dog, which is actually the kind of results we have on a scientific base, because we reach now close to 20 scientific publications that show that it definitely works as well as the PCR. So being tested by dogs, it means it's non-invasive. You have immediately the results. It doesn't cost much. The cost, if we deployed in all France, for example, would be something like 30 or 40 cents of a euro per testing, when it's 75 euros for one PCR. And if you ask to people their choice of test on arrival, for example, on an airport or a port, where you see that being sniffed by dogs is definitely number one, except in China. So that's what I wanted to tell you. I didn't check if I was inside the 7 minutes, and if I'm more than that, I do apologize. We've been helped for all these works by the World Health Organization and by 3 companies, two French laboratories, vet laboratories, and 1 pet food company that I have to thank, because we never got a cent from our government, and we're definitely the only country on earth that was not helped to make such works, but maybe one day it will come. Thanks for your attention.
Thanks very much, Professor. And if you guys watching at home have questions about this whole process, I mean, it's interesting that this could be a new reality we see at airports. So go ahead and put them in at the bottom right of your screen, and I can ask them to him. Okay, so let's go to the other partner of the Pet Alliance, and that is Annette Palamba, president of FEDIAF, the trade body representing the European pet food industry. Annette?
Yes, thank you. And I really want to start by thanking Professor Grandjean for his inspiring and very relevant example, I think, of how pets can have a positive impact on society and, of course, on our human health. I would just like to elaborate a little bit while I'm sitting here with my puppy. At FEDIAF you can always find the latest pet data, and the last ones that we published just before summer actually showed indeed that the number of pets has been increasing across Europe, which was also alluded to already by some of our speakers. If we look at the figures now, there's about 200 million cats and dogs in Europe, and close to 100 million other pets. And you can think of ornamental birds or small mammals, but we also count, for instance, the aquaria. And I think actually if we would be able to count the fish in the aquaria, those species would probably be the winners, because there's about 10 million aquaria across Europe. So, as I said already, and I'm sure you have been hearing or reading about this, that the number of pets really has increased because of the pandemic. We do not have hard research in all the countries where FEDIAF is represented, but where we do, it's very clear that the number of households that own a pet, and I'll put this one down for a moment, the number of households that own a pet, really has increased, and many of those households are actually first-time pet owners. So for total Europe, the estimate now is that about 38% of all households own a pet. And as we've also heard already today, many people also claim that their pet has been a great comfort during the pandemic. Of course, especially in the very uncertain times in the beginning, it of course makes a lot of sense. And as was alluded to already, there's a lot of research available on the positive impact, both physical health and mental health. So, from the side of the Pet Alliance, we therefore would like to ask this open question really to the European Commission in terms of, whether you see the link between this well-researched human-animal bond and the EU policies, for instance, on topics like social inclusion, healthy aging, which was mentioned a few times, mental health, of course, or health and well-being of younger people. And we heard the MEP also talk about this. So, we would really like to start a discussion. How can we leverage all this research which is available and translate that really into policies? And it would be very interesting to hear the thoughts of the next speaker. So thank you.
Thanks very much. Indeed, let's put that question to our representative here from the Commission. We have Andrea Gavinelli from the European Commission's Health Department. Andrea, what do you think about this idea of linking these issues in EU policies on social inclusion, healthy aging, mental health, etc.?
Yes, thank you. Hi, it is a pleasure to be here to play as a veterinarian and head of animal welfare unit and antimicrobial resistance, hearing and talking about this human-animal interaction, going into something that is out of what was till now the center of the EU acquis, that was in fact animals that have been an investment for humans in terms of producing food and goods related to it. As you know, we have an acquis in which the legislation is practically talking about pets, merely cats and dogs, in a moment in which we transport them with very few requirements, but very, very little for the rest. The health perspective is clearly well developed with the requirements for moving around in the EU and protecting from important diseases like rabies. So coming to the specificity of your question, I feel that it's really an appropriate moment to discuss and to assess how much good could be done with a more harmonized approach in terms of the EU. To make safe and secure what is the use of these animals, that sometimes is also bringing an economic interest in it. So getting into a market situation or a business-like situation, this means for the EU a reason to look into it and to act. This is also an element that comes into the particular moment in which Europeans are showing an important obligation in the sense of the need of caring about animals, in this human-animal bond that becomes more strong than before, even looking to not only what we have in the treaty, but really what is coming from the different national provisions. So to put it in what is happening today, we are in fact in few days launching an open public consultation, a formal step that will offer the citizens the possibility to convene and to convey to Brussels what they think about the revision of the acquis of the EU in animal welfare. And a process that, as you know, is a reform that started already with the questions of sustainability of farming and the production of food when we talk about the farm to fork. This opened up a larger reflection than expected. And that's why we are talking about now pet animals. The deadline of this reflection is in fact the first set of commission proposals that will come in 2023. And they will go through, in fact, elements and impact assessment that are needed. One gray zone of all this is that in the 20 more years of investment in the EU in this area of welfare and protecting animals, we have to really collect and learn more about the scenarios and the data that are related to, so the numbers of the animals and the species that are in fact involved in this operation. That's the beginning and very essential for us.
Thanks very much, Andrea. So let's get some feedback from the audience about what you were just saying. So you were outlining different things that the Commission is doing, different things that are possible. Let's put another poll question using Glisser to our audience. So the question is, to ensure as many Europeans as possible can benefit from pet power, what would you like to see? More research into the economic benefits of pets to people and healthcare systems, improved education to pet owners on responsible pet care and well-being, awareness raising around issues linked to the illegal trade of dogs and cats, recognition at EU level of consensus-led standards for the welfare of assistance dogs, or EU-wide harmonization of standards for animal-assisted intervention. You may want all of those things, but you have to pick one. Which of those things do you think should be the #1 priority out of those things listed? And while you guys are answering that, I did want to put a question to Andrea. So Andrea, you talked about some of the things the Commission is looking into, particularly with the aging strategy. What about research? We know that Horizon Europe funds a number of research projects, with many projects that are linked to health, both mental health and physical health. And human-animal bond research is still quite reserved to those working in the domain, and it's not necessarily been embraced, across the research spectrum. So is this something that could be considered in prevention strategies, particularly when it comes to Horizon Europe, Andrea?
Thank you, Dave, because this is a real important issue here. In fact, we have to say we are living quite a revolutionary moment in terms of seeing the role of the EU in terms of this human-animal bond and how far our role could help to secure good health and good welfare to both. This is in fact why the Horizon research went in direction that we are not really in this sense, despite we have a concept of One Health that is also part of some research. The research is about, in fact, the important role of preventing diseases, and also very important to say, to fight against situations that will really put at risk the health of both human and animals. But there is this concept of welfare that is really connected, that is missing. I think the big step up will be if there will be, in fact, enough motivation and justification to streamline all the different things that are happening in member states and bring them to Brussels, and so to start to work on this and secure it. The use of all this research, in fact, will only be done when, in fact, the other sphere, the administrative, legislative, and policy field will start to discuss, as we are doing now, the positive contribution that could be made. It's a very sophisticated transition anyway. And I conclude just saying, because it is a transition between the concept of the role of animals in the EU per se. We started with a concept of animal when we were discussing at the EU level as animal producing something. And the role of these animals was really functional practically to the common agricultural policy alone. That is a transition that is happening today strongly, we see, is the issue of today in this discussion. And it's a big challenge, in my opinion.
Annette, what's your feeling on this? I mean, do you see a way that this could be integrated into Horizon Europe?
In my opinion, there is this possibility because Horizon is an innovative, very innovative and good platform of bridging research and integrating it. So the question is more to detect the priorities and the goals we would like to highlight there. So to have someone that bridge this request to in fact, the organizer of Horizon, the coordinators, and the different research bodies in Europe. The demand could come also from that side, institutes and universities, and even social representatives of the society. So this is really important.
And Annette, what do you think about this integrating it with research issue?
Yeah, I must say, I would be fully aligned, and as we mentioned already, there's a lot of things already available, but we are more than willing to also discuss, of course, with the European Commission on further research or going deeper in certain areas. So we would be very interested to liaise and see where the needs are and which things are most useful to take forward. Yeah.
Makes sense. Okay, so we have our answers to the poll question that was put out. So 24% said the first answer, more research. Improved education got 27%. Awareness raising around these issues got 25%. Recognition at EU level of consensus-led standards got 13%. So it looks like our winner is improved education, although there's a pretty even split between all of these answers. So I think that's interesting. I think that there's no clear, obvious priority, that all of these are kind of good ideas that are being embraced. Okay, let's take a couple of the questions that have come in from the audience. This is a question actually for Dominique. Dominique, the questioner asks, what is the specificity and sensitivity of the dogs as test units for COVID compared to PCR tests? So is there, I think the heart of that is, how does their accuracy compare?
Well, it's we have right now 16 publications reporting that sort of results, and it's totally equivalent with PCR. The average sensitivity is around 95%, and the average specificity is around 92%. So, PCR, as I said, is not a gold standard simply because there are so many mistakes that can be done. The advantage of the dog is that the dog, which is well trained, is never going to lie. He's never going to make mistakes. He might be sick or tired or whatever, but it's up to the dog handler to decide if the dog is able to work or not on such days. But we definitely, I would say all the people who are working on the subject actually will say, well, at least it's equivalent to PCR and maybe better than PCR. So it might hurt a lot of people, and we know it hurt part of the industrial system because the people who run the PCR, they also make business, of course, but that's the way it is.
So our next question is for Andrea. So the questioner asks, within the current review of animal welfare legislation in the EU, what provisions will there be for companion animals? What about assistance animals? Does the EU offer any support with building guidelines for animals that are effectively working animals?
Well, let's say first that in the frame of the animal welfare, EU animal welfare platform that combine stakeholders of different origins and member states, they have been able to develop already European guidelines that help to go for better care of pets and their marketing. So this is an important step that has been done because it was the first time that it was taken up at the European level. Coming to the question, well, now we are in a phase, as I said, in which we are assessing the different options and the way that we can cope with the impact assessment to be done for the new legislation. This means we have to really see if we can bring on an added value from an action in the line of what suggested. That's why we need all of you. We need, in fact, to bring to Brussels evidence and data that could help us to understand if any situation could be improved thanks to our work. Right? In principle, of course, we are already examining what's happening in member states. But we will be surely helped if we will know and we will have knowledge from stakeholders of any possible capacity in that sense, so to improve the situation.
Okay, well, let's take one more question from the audience before I hand it over to Sirpa for some concluding remarks. Annette, I think this would be a question for you. The questioner asks, do you see a role with healthy aging to highlight the scientific benefits of pet ownership? What kind of role do you see there?
Yes, absolutely. I think, especially with a population that is getting older, there's indeed a lot of benefits of having a pet, on overall health and mobility, of course, directly, but also to maintain a healthy heart, and we heard the MEP indeed start with petting your animal and lowering your blood pressure, but I think also very much on the aspect of loneliness and isolation. So I think especially when people get older, sometimes they lose their partner. And then, of course, having a pet, and of course, then in that case, especially a dog, which forces them to go out a number of times per day. I think that can be hugely beneficial. And indeed, there's also numerous examples of how pets, indeed, for people once they are in a care home, how pets there can help and provide companionship and comfort and release stress levels. So I think in all those areas there's really good examples of how it can be how this can contribute. Yes.
Great, thanks. So in fact, Sirpa had to leave earlier, so I'll go ahead and close out the event. Thanks to everybody for their interventions. I think it was super interesting, both from the perspective of what policy can do to kind of integrate the benefits of pet ownership in with the policies, particularly as we're coming out of the coronavirus pandemic. And of course, the project we heard about the dogs at the airports, I mean, that's really interesting. That could be like a major part of our lives and travel now. I thought it was particularly interesting how it can work for populations that where a traditional PCR test is difficult, like somebody with autism or a young child. So that's was all quite interesting. And I loved seeing your photos as they came in of the pets. I'm pretty convinced I'll have to think about it some more, whether or not I'm going to get a cat. I think I'm going to take a couple months, and it may be a thing for early 2022, but your photos were all very adorable and inching me toward being convinced there. So thank you everybody for spending your afternoon here with us to talk about pet power, and definitely keep getting involved and seeing how these types of pet ownership issues can help us as a society, both with our mental health and our physical health. I wish you a great evening.